This is the education portion of the injectable video. So we're going to start with the intradermal injection. For intradermal injections, you're going to inject at between a 5 and a 15 degree angle. The trick to inserting it is you want to insert it about 1/4 of an inch into the skin with the bevel facing up, and when administering the injection, you want to see a bleb or a little bump just under the surface of the skin. That's how you know that you've administered it in the correct location. The needle length can be between 1/4 inch and 5/8 of an inch, and the gauge is going to be between 25 and 30 gauge. And the sites of injection are going to be the ventral forearm, the upper chest, and the upper back. And the max that you're going to administer here is going to be 0.1 milliliters. And an example of an intradermal needle is going to be this. So we have a 25 gauge by 5/8 inch. So this is the largest needle that you would use, but here's an example of an intradermal needle. Next up, we have a subcutaneous needle. So the subcutaneous is going to be injected between a 45 and a 90 degree angle. When administering, the trick to doing that is you're going to pinch, and if you can pinch at least an inch of skin, you're going to inject at a 90 degree angle. Otherwise, if you can't, you're going to inject at a 45 degree angle. The sites of injection are going to be the lower abdomen, at least 2 inches away from the umbilicus. You can administer it into the thigh. You can administer it into the lower back, the hip, or the back of the arm, anywhere where there's large fatty deposits. And the needle gauge is again going to be between 25 and 30 gauge. And then the length for this one's going to be a little bit longer, so between 3/8 and 5/8 of an inch. And you're going to administer up to 1 milliliter with this. And then the final injection is going to be intramuscular. So for intramuscular, the needle gauge is going to be between 20 and 24 gauge. The length is going to be between 1 inch and 1.5 inches. You're going to inject this always at a 90 degree angle, and the trick to remember with this one is to aspirate, so pull back on that plunger to ensure that you're not in a blood vessel. And then an example really quick for the subcutaneous is going to be the classic insulin needle, which has a about a 1/2 inch needle with a 29 gauge needle. So this is a good example of a subcutaneous. And then here we have a intramuscular needle. It's a 22 gauge by 1.5 inch. It is a big, thick, chunky needle. Look at that. And then for the sites of administration for intramuscular, you're going to either go into the deltoid. In the deltoid, you could administer up to 1 milliliter of whatever you're injecting. And then into the ventrogluteal or the vastus lateralis, you can inject up to 2 milliliters of whatever you're injecting. So we have, all right, cool. And then for the sites, so here we have for the vastus lateralis, we're going to find the greater trochanter and place our palm on it. We're going to find the lateral femoral condyle, which is going to be the outside aspect of the leg. You're going to create a rectangle, and you're going to want to inject right in the middle of that rectangle here into this muscle. Then next, we're going to have the ventrogluteal injection. Again, you're going to find the greater trochanter. This is going to be your major landmark. You're going to point your finger towards the anterior superior iliac spine, and then you're going to point your other 3 fingers towards the iliac crest. And where you've created this triangle, you're going to swab it and inject straight into the muscle here. And then finally, for the deltoid injection, we're going to come to the deltoid region. We're going to find the acromion process here. We're going to go about 3 fingers or 2 inches down, and just below that, right into about the center of the triangle of that muscle, we're going to inject.